All right, let's jump right in. Today we're going to dive into a medical mystery that's hiding in plain sight, inside one of the most common things we all get. We're talking about a sore throat and what happens when the cure is anything but.
I mean, we've all been there, right? That awful, scratchy feeling where it hurts to swallow, hurts to talk. You just want it to be over. It's miserable.
So, here's the question that sits at the very heart of today's story. What if the one thing that's supposed to make you better actually makes you so much worse? We're about to follow a case where exactly that happened.
Okay, let's set the scene. Our story starts with a 15-year-old kid who shows up at an urgent care clinic. And let me tell you, it's immediately obvious this isn't just a cold. He is really, really sick.
So, here's the rundown on this poor guy. He's had this brutal sore throat for 3 days straight, he's running a pretty high fever, and he's got what doctors call severe malaise, which is basically that feeling of being hit by a truck. Swallowing is a nightmare, and he says he's never felt anything this bad before.
And when the doctor takes a look down his throat, oh boy, the evidence seems crystal clear. His tonsils are huge, they're fiery red, and they're covered in those classic little white spots of pus. I mean, every single sign is screaming bacterial infection.
So, faced with what looks like an open and shut case, the doctor does exactly what you'd expect them to do. It's the logical next step.
The diagnosis seems like a slam dunk. Classic bacterial tonsillitis. You know, strep throat. So the treatment plan is just as straightforward. A prescription for amoxicillin, which is the go-to antibiotic for the stuff. It's textbook medicine.
But this is where our simple case gets complicated. He should have been starting to feel better. Instead, he shows up at the clinic the very next day, and he's not better. Nope, he's taken a serious turn for the worse.
And here's the twist. The kid is now covered head to toe in this splotchy red rash. This is totally new. This was not part of the deal, and it's pretty alarming to see.
Okay, so your first thought, my first thought, everyone's first thought is an allergic reaction, right? It's gotta be the amoxicillin. It makes perfect sense. But was that what was really going on?
Well, when the doctors started digging a little deeper, the plot thickened. The simple allergy idea just wasn't fitting with the new evidence. On top of the rash, he's now got pain in his stomach. And, this is crucial, he has swollen lymph nodes, but specifically on the back of his neck. Remember that detail, folks. It's a huge clue.
To really understand what's happening here, we have to hit pause and do a quick breakdown of the two major culprits behind sore throats. Because even though they can feel the same, they are worlds apart. Okay, so this is where the real detective work comes in. Think of it like this. A virus is kind of like an all-out invasion. It affects your whole body. You get the runny nose, the cough, maybe even pink eye. The symptoms are just everywhere. But a bacterial infection, that's more like a targeted strike. It hits you hard and fast, right in one spot, with a high fever and that awful throat pain, but usually without all that other sniffly coffee stuff.
Okay, with our newfound knowledge, let's get back to the case and introduce our number one suspect. It's a virus that is famous for being a master of disguise, a real imposter. We're talking about mononucleosis.
You've probably heard of mononucleosis, or just mono as the kissing disease. It's this viral infection that is an absolute pro at making itself look exactly like a nasty case of bacterial strep throat. It's a real trickster.
So what's in the classic mono playbook? Well, first, it puts on its disguise. A really severe sore throat with those white spots, just like our patient had. But then you get the real clues, those swollen lymph nodes, especially on the back of the neck. The abdominal pain, which can happen because mono can make your spleen swell up. And of course, that soul-crushing fatigue. See where this is going?
One of the original articles I read about this had the perfect analogy for mono. It said, it looks like a cat, it meows like a cat, but when you check the DNA, it's a dog. That is mono in a nutshell. It looks and sounds exactly like strep throat, but deep down, it's a completely different animal. Now, what about that rash? That's the one piece of the puzzle that seems out of place, right? Well, get ready for this, because this one number is the key that unlocks this entire mystery.
80 to 90%. That's the chance that someone with mono will break out in a massive full-body rash if, and only if, you give them amoxicillin. It's not a true allergy. It's a very specific, predictable reaction between this virus and that antibiotic. So the rash wasn't a side effect. It was the final flashing neon sign that they were treating the wrong illness.
So with all the evidence laid out, we can finally close the book on the case of the worsening sore throat. Let's just run down the final checklist. That severe sore throat with pus? Yeah, it fits both. But then look at the other clues. Those lumps on the back of the neck? Check for mono. The stomach pain?
check for mono. And that rash after taking amoxicillin, that is the smoking gun. It's a perfect match. Our patient didn't have a bacterial infection at all. He had mono.
So what's the big takeaway from all this? First, it's a great reminder that most of the time, a sore throat is caused by a virus, where antibiotics do absolutely nothing. Second, giving antibiotics when they aren't needed isn't just pointless. As we saw, it can actually cause real problems. And finally, it just hammers home how critical it is to look at all the clues to get the diagnosis and the treatment right.
This case isn't just some weird medical trivia. It's a powerful lesson that our bodies are constantly sending us signals. The clues are usually there. You just have to know how to read them. So it makes you wonder, doesn't it? The next time you feel that familiar scratchiness, what clues are you going to look for?